And one of the biggest complaints I had of that experience in the inpatient ward is I knew one thing that my body personally needed and could benefit from when I was going through that manic episode, that shame and embarrassment that I had to deal with because I did a lot of dumb things when I was manic, the elements of depression, the racing thoughts. I was willing to take medicine, but I also knew that simply going outside on a walk and exercising would have been one of the most beneficial things I could do for that experience, in that experience.
You
But no,
think at an inpatient setting there would be opportunities for exercise? Was it not like that?
no, I have no exercise.
Interesting.
No, in my opinion, meaningful exercise. I remember actually in that mental health hospital stay, the first time I ever did yoga in my life was at that mental health inpatient stay, which was kind of cool.
And you still do it to this day, right?
I
I know
still
that's a
do
big
it
part
to
of your
this
life.
day. Yeah. So that was cool. I remember they also did some movement um, classes when I was there. Remember I was a 22-year-old man at that point, little lighter than I am now, Mr. June. I must say, I'm about 230 now. I was probably about 200 pounds at that time. I don't know.
Pure muscle, right? Ripped.
Yeah, yeah. So like, it's tough, when you're in an inpatient stay. Because I had fellow patients on that unit that were triple my age at that point. I was 21 years old. So doing like an exercise class amongst that wide age range, I get is really hard because we got involved in like I remember doing a Zumba class there. But I was manic. You remember? Like I had a manic episode. And when you're manic, you deal with such an excess feeling of energy. That's how I describe it. Like, and sometimes that energy can go to creative things or where I, in a sense, am like grandiose, maybe egotistical, but also sometimes irritable, sometimes also highly anxious, ruminating. Sometimes it leads to insomnia. And exercise has always been a really good tool for me. And I remember on that inpatient ward, there was no treadmill. There was no stationary bike. There was no opportunity to go outside because, oh, sir, you might run away. It's like, I remember like arguing with one of the nurses, like, yo, I will not run away. I will come back. I promise. Just let me just go on a walk. Like, please. Like, they, of course, wouldn't let me.
Okay, let me ask you a question. If a patient told you that and you're the attending at the inpatient unit, would you believe that patient? And would
Look,
you let them out?
yeah.
You would?
We talked last episode, tune in if you didn't listen to that episode on disorder part 2. But we got into a great philosophical discussion how we were talking about patient autonomy. And I think one of the best ways to assist in mental health care is if the patient is willing to play ball, if the patient is willing to buy what you're selling as a practitioner versus me forcing you. Now, I get, and I've done it even, there's certain situations where we do have to force care. I've had to force medicine before, and I don't like it.
Yeah, it's
I've
a
done it,
unpleasant feeling.
but I don't like it. And what I mean by that, if you don't even understand what I'm talking about, is, I, as a physician, don't physically do it, but I do put the orders in that, yeah, we got to give that patient over there medicine by needle. And I do this because I'm very concerned with both patient and staff safety in the event of these crises, but still not a good sensation. But that being said, I would, the one thing I would love to do, honestly, as a physician, when I'm one day, is roll the dice and be like, you know what? Me and you, patient, for the next 20 minutes when we have this patient encounter on the inpatient unit, we're going on a walk outside. And there will be some patients that probably run away, but there'll probably be some patients that won't either. And that I think would value that experience of walking around outside, enjoying the sun, getting exercise, and having a high quality conversation with their physician.
So I don't disagree that for patients that are, behaving appropriately, in essence, that getting out, maybe even going for a walk with you, um, it would be extremely beneficial for them. But at the same time, if you have even a single patient where there's an issue, that's a lot of liability. And I think,
Yeah.
many people don't realize this. And I certainly didn't before I started residency. There is the clinical practice of medicine, there's the ethical practice of medicine, but there's also practicing from the lens of liability.
Yeah.
And sometimes, to the detriment of the patient, unfortunately, that is the choice that a lot of physicians do end up making, because it is a fact that we live in a very litigious society. And you hear about lawsuits against doctors all the time. And in a psychiatric setting, that is, I don't know, I would feel a little bit hesitant about letting patients just leave and walk outside. Even though, I agree it would probably be beneficial for a lot of people, but just because of how dangerous it may be, if I can use that word.
I mean, I think that's fair, but I also think that lawyers are part of the reason why our mental health or healthcare system, period, is broken. Healthcare system, comma, is broken. I don't know. I didn't get into medical school for my punctuation skill set here, but either way, I think that's so improper, and I get there's risks, and I get that there's a potential for liability, but I really think that that's unfair that should impact how I want to treat that patient. And because I just so strongly believe, like me and you both graduated from osteopathic medical school. We can talk about pills all day until we're blue in the face, but there's nothing in this world that calms me the same way as when I'm on my surfboard out in the water. Nothing that even touches that. Nothing when I'm on the top of the mountain, a skiing or something like that. Like there are experiences with your body being outdoors that pharmacology can't touch. Even in the world of like psychedelics and all these things, like these are real experiences that I do think have medicinal value. And I don't think we lean on them enough. We get so lost in the weeds. And I think a lot of it, in a sense, is monetarily. Because if we're not prescribing medicine, the insurance company doesn't necessarily get paid the same way. And we don't. Why did he need to see a medical doctor? Is all you prescribed him was exercise? Blah, blah, blah. Like we could have just hired a trainer to do that. Blah, blah, blah. You're the doctor. We want you offering the top skills. That's why you went to medical school, to provide medicine. And so I think we get lost in this world of, like you said, liability, where we're thinking about legal. And that's also, I would argue, just money.
Right.
From one money to another. And then also the influence of pharmacy and all these things. And look, I'm a doctor. I prescribe medicine. I think pharmacy has its place. But not always. And I feel like a lot of times we ignore. Like I think that my mental health experience on that inpatient psychiatric ward would have been radically, radically different, and my attitude towards the mental health system would have been different if I could have gone out for a walk in the woods, and engaged with the mental health treatment in a different way. And why I bring this up, June, is so I couldn't go outside, right? And the unit at this Charlotte Hungerford was not big. This is a small community hospital in rural Connecticut. So what I would do in those stupid little, hospital socks with the grip on the bottom, I would like sometimes run the hallways and I get yelled, "You can't do that." So I would just walk back and forth, literally for like
Pacing.
all day. And they thought I was like psychotic, which arguably maybe I still was a little bit because I was at the tail end of manic episode. But like a lot of it, I remember like was just trying to like clear my mind, in a sense, just walk, just exercise. And I was getting more annoyed and irritated because they kept asking me like if I'm okay. And it's like, I'm actually not okay because you don't even let me go exercise and do anything. And this is the next best thing. And it was extremely frustrating. And it was actually a big reason of why I even got in this business in the first place, of going to medical school, because I want to be in a position of influence and power and be like, yeah, no, that experience, although it saved my life, it could be improved greatly. And why can't we talk about using resistance training when a patient is highly agitated and irritable? Like you brought up a patient that you said, yeah, but like what if there's a patient who's not behaving well, who is maybe doesn't warrant going on that walk with a physician? And what I would counter, it's like, yeah, but maybe they would be better behaved if they could go exercise for 30 minutes and like get out some of that energy. It's like, I get there's risk. And like, so I have seen some units that have some outdoor spaces with like basketball courts, but like, how come that isn't measured to the same capacity as, oh, did they take their medicine last night? Did they take a shower? Are they doing their normal activities of daily living? Like, why aren't we measuring exercise? And why aren't we really trying to prescribe exercise the same way that we prescribe our SSRIs, our mood stabilizers, or antipsychotics?
Well, Logan, I don't think that's that's a issue that's up to the physician per se. And the reason is because, I mean, in many facilities that we work at, whether we can safely let a patient go outdoors is more due to the policy of the hospital and the system that we're working in at the
Hmm.
time. Because, and I just want to preface what I'm about to say with the fact that when I say that I wouldn't feel comfortable letting a patient go outside, that's only under the circumstance that there's no safe way that's provided within the structure of the hospital for me to do that. Because there are many places, and we've both worked
Right.
at, like, for example, like a state psychiatric hospital where patients are there for multiple months, sometimes maybe even a year or two at a time.
Right.
Those places, they have structure in place where patients can get outside, take a walk, maybe even go for a run in a safe and structured manner. There's supervision, there's gated fences. I mean, it almost sounds like a prison.
Right.
In a way, it kind of is, and it kind of does look like one. We can do an episode on state hospitals at another time. Freudian
Right.
slip there.
Right.